Alright, so I have the starter post for healthcare. So I just wanted to talk about that the U.S. actually, well, I just want to start with this. The U.S. is ranked 37th in healthcare, according to the World Health Organization, and first is actually France. And the U.S. actually spends the most per capita on healthcare, but we're ranked 37th. And then, unfortunately, it says that the healthcare. Oh, this is in our lecture notes, but that the U.S. wastes almost $7 billion annually. And then I wanted to talk about the uninsured, because the uninsured have a big impact on those of us who are insured, because that's part of the reason why healthcare costs are so high. But unfortunately, healthcare is kind of difficult to get because you have to be qualified for the healthcare by your income, but oftentimes like children are covered because of CHIP, which is a child health insurance program. But anyways, the uninsured are more likely to go to the emergency room, which is very expensive. And then the insured people, their rates go, or not their rates, but like the cost of their healthcare goes up, just to compensate for that. Let's see. And then another thing that I wanted to talk about was that overall, here, let's go real quick to the chart. The U.S., I mean, their life expectancy is 78 years old. But we're spending, it says, just comparing the cost per capita, it's roughly 6,700 per capita per year. And Japan's only doing 2,500, and their life expectancy is 83 years old. And it just, if you look at the numbers, other than Mexico, because Mexico's infant deaths per 1,000 is 29, and that's pretty high, but ours is 7. In between Japan, Netherlands, Canada, and Mexico, in the United States, that's the 4th highest, which is not good considering how much we spend on healthcare. That doesn't seem to add up. And then just some public health issues that definitely add to the healthcare would just be like, I mean, the obesity rates in the United States are, I mean, it's ridiculous. It's getting really bad. Diabetes, specifically type 2, asthma, abuse and neglect, and mental health problems is a big one, because a lot of them, like I know the place that I am just finished my internship at actually, they only take like Medicaid, I'm sorry, because they're helping low-income people. And then uninsured children. It says that there's about 7 million children that are uninsured. Which, I mean, I guess with programs like CHIP, I don't really understand how that number is so high. I don't know exactly what qualifies you. If somebody knows that answer, that would be nice. But I just don't understand how you can deny a child health care if they need it. And one thing I also wanted to talk about was that you can't deny people insurance because of pre-existing conditions anymore, which is great because the fact that that was even a thing is horrible, because I think that would make it extremely difficult, and it would make it already, I'm sure still does, makes their rates really high. So that's probably very miserable for them, and on top of the stress of having whatever chronic disease, I'm sure that's very difficult. And then one idea that was in the lecture that was really interesting to me was that it says the problem isn't just the uninsured, it's also the underinsured. And that's very important too, because for example, a lot of people who, even if they have insurance, they have really high deductibles, and I mean, they still have to pay out of pocket for a lot of the things. I know, for example, my supervisor was telling us about her insurance coverage is horrible. She has a really high deductible, so any procedure she has done, she has to pay for it. And that, to me, just kind of defeats the purpose of insurance, but unfortunately you get fined for not having insurance. So that just adds to poverty, and it just, again, continues the cycle of poverty. Let's go over here. And then, there's a lot that we can talk about with this. I'd be happy to respond to anybody who wants to add, so we can just continue the conversation. I don't want to make my video go too long, so thank you.